Good afternoon. I'm Noe Ortega, Secretary of Education for the Department of Education. Thank you for joining us here today for an update on critical issues facing our schools. As you already know, the past few school years have been unprecedented and full of disruptions. Our students and their families have faced so many unknowns since 2019, so many new experiences, and so many changes. But our educators and our administrators had to think creatively and act quickly, decisively, on any number of new challenges that appeared from one day to the next. But despite all that, I'm here today with a continued message of hope. Our schools and students are resilient, and under these extraordinary circumstances, this has been a good start to the school year. Kids are excited to be back in the classroom, learning and growing alongside their classmates, something that they've been asking for some time now. Safety has been paramount. Educators and administrators have been doing the right thing to keep COVID at bay as much as possible. As we take this day by day and respond to challenges as they arise, we know that what matters most is that kids are in the classroom, that they're continuing to learn in person around their classmates. We know that's what's best for the educational outcomes, socialization for these young kids, and for our future as well. And we're happy to say that it's going well so far. Additionally, we can continue to keep our schools open and operating fully in person with federal support through the ARP-ESSER program funds that we've received. What's more, that funding can also be leveraged to address transportation issues. PDE wants to thank our teachers, students, communities for their commitment to keeping themselves and each other safe and healthy and keeping kids in the classroom where they belong. This pandemic has also taught us to expect unprecedented challenges that will require creative solutions. One of those is the national shortage of bus drivers, which many school districts in Pennsylvania are also experiencing. I know it can be frustrating to our students and our parents, and schools leaders are working incredibly hard to address these needs. The need for bus drivers isn't something we can fix overnight, but by working together, we have tackled other complicated problems during the pandemic, and I believe we can make progress on this as well. With that, let me now turn the podium over to Deputy Secretary Kurt Myers from the Pennsylvania Department of Transportation, who has an update on transportation busing for you. Thank you.
Thank you, and good afternoon. I'm Kurt Myers, I'm Deputy Secretary for Driver and Vehicle Services at PennDOT. Throughout the Commonwealth, we currently have a little over 42,000 school bus drivers, which is the lowest number of licensed CDL school bus drivers the Commonwealth has had in the past 5 years. That is over a 4% decrease since 2017 when we had 44,000 drivers. In response to this shortage, PennDOT will be mailing approximately 375,000 current CDL holders across the state with information about the need for school bus drivers and how to obtain the correct endorsement to become a driver if they are seeking work or supplemental income. For anyone who wants to become a school bus driver and doesn't yet have a CDL, that's the first step. Anyone 18 years or older may obtain the school bus and passenger endorsements on a CDL to obtain a school bus license. For a list of the steps and forms to obtain a CDL and the school bus endorsement, please visit dmv.pa.gov under the School Bus Drivers section. Additionally, PennDOT is temporarily opening CDL skills testing on Mondays for 4 weeks beginning October 18th. CDL skills testing takes place at 23 locations throughout Pennsylvania. These additional testing appointments are intended to allow those who are interested in increased opportunity to schedule time for a CDL skills test. Individuals may schedule a CDL skills test by visiting PennDOT's website, selecting our schedule a driver's exam under Driver Vehicle Services, or they may simply call 717-412-5300. Lastly, under certain circumstances, federal elementary, secondary school emergency relief funds may be used to provide a limited reimbursement directly to parents or guardians to safely transport their students to and from in-person schooling. PennDOT looks forward to doing our part to ensure the safe and effective transportation of our Commonwealth students. I now invite Secretary Allison Beam from the Pennsylvania Department of Health to share her update.
Good afternoon. Thank you, Secretary Ortega and Deputy Secretary Myers. Great to join you today. And I join you in commending the resilience and dedication of our school students, our teachers, our staff, and our educators, and our families in being able to have a smooth start to this school year. It continues to astound us how quickly schools and school leadership have been able to adapt and move forward despite challenges we all face from this global pandemic. It's very encouraging that more than 500,000 school-age kids in Pennsylvania are already vaccinated. We know that vaccinations are one of the best ways to prevent illness from COVID-19 and keep students learning in person. That's why we encourage everyone eligible to get vaccinated. And we encourage schools to help make it as convenient as possible for students and their families. It's not too early to schedule a vaccination clinic in October for students 12 and older, and again in November in anticipation of federal approval for vaccinations for kids between 5 and 11. Currently, only students 12 and older are eligible and encouraged to get vaccinated against COVID-19. But there's good news this week for younger students. Pfizer submitted its application to the federal government for approval to administer the vaccine to children between 5 and 11 years old. Now, the Food and Drug Administration, as well as the Centers for Disease Control and Prevention, will carefully review the application and the extensive testing and data that was submitted along with that application. The safety review process is anticipated to take several weeks. Meanwhile, school districts are encouraged to contact local vaccine providers to schedule vaccination clinics. Most schools are making arrangements directly with local trusted vaccine providers. So we don't have specific data on the number of school clinics happening, but we can see that the vaccination numbers continue to increase. Just last week, our team at the Department of Health helped to connect 2 schools with vaccine providers to set up vaccine clinics. This continues to show that the process is working. In fact, for eligible adolescents, 21.9% of children ages 12 to 14 are fully vaccinated, and 42.6% of children ages 15 to 19 are fully vaccinated. We need to keep making progress on vaccinations, but at the same time, we need to do more COVID-19 testing. Certainly, anyone who has symptoms needs to get tested right away so that steps can be taken to protect others. But broad testing of students, teachers, and staff is another important strategy in the fight against COVID-19. I am pleased to report that nearly 400 schools are already enrolled in the 100% federally funded COVID-19 testing program that the Wolf administration launched at the start of this school year to provide safer in-person environments for students, teachers, and staff. The screening testing program is one part of the COVID mitigation strategy that also includes, of course, vaccinations, physical distancing, facilities improvements, face coverings, and hand hygiene to reduce the spread of the virus and keep students learning in the classroom. In the past week, more than 800 screening tests have been conducted in schools across the state through this free initiative. The combination of ongoing testing, masking, and vaccinations will help keep students learning in the classroom this school year. Schools can apply to participate in the free COVID-19 testing program at anytime. The Department of Health is encouraging all schools to take advantage of this resource because early detection of COVID-19 can help keep schools open. A key part of this testing program is also the quick turnaround time, usually 1 to 2 days for results. This allows schools to quickly identify if they have a positive case and to take action to prevent the spread of COVID-19 throughout the school and mitigate any disruption in learning. To support schools in the event that students test positive, the Department of Education's website provides valuable information about responding to COVID-19 cases in schools. The Department of Health will continue to work closely with schools and the Department of Education to support school officials so that we can keep students in the classroom and COVID-19 out. Now, I'm happy to return the podium to the Department of Education Secretary Noe Ortega. Thank you.
Thank you, Secretary Beam, and thank you, Deputy Secretary Meyer, as well, for your willingness to work to ensure that we can keep our students, educators, and communities safe. It's important now more than ever that we leverage all of the resources available to us, whether it's funding, networks at our disposal, to alleviate some of the workforce shortages and transportation challenges. And we're prepared to do just that, as you've heard today. Finally, I would be remiss if I didn't add that over the past few months, I've personally visited a number of school vaccine clinics, and we're so thankful for the efforts that our school administrators have done to make sure that they keep learning safe and keep our students in the classroom throughout the academic year. It's important for everyone to get vaccinated, as Secretary Beam has announced, and to also remind everyone that this has been about multiple layered mitigation efforts, right? Whether it's face masks, vaccines, and other things that have been described in this conference. We know that there's a lot of information that was shared with everyone today, so we want to give the media an opportunity to ask us some questions as well. So I'll now turn back and open it up for questions.
Good afternoon, everyone. For awareness, this meeting is being recorded, and thanks for joining our briefing with Education Secretary Noe Ortega, Acting Secretary of Health Allison Beam, and PennDOT Deputy Secretary for Driver and Vehicle Services Kurt Myers. And remember that later this afternoon, this will be available on PA Cast. Today, we'll be taking one question from each reporter to allow for as many reporters as possible to ask their questions. Please use the raise your hand feature to indicate if you wish to ask a question, and also indicate which speaker you are directing your question to. First up, we have Mike Rubenkamp from the Associated Press. Mike?
Hi, this question is for Secretary Beam. Secretary, as you know, the superintendent of the Hempfield School District testified at a Senate hearing last week and, expressed really a significant amount of frustration with what he views as the lack of communication and guidance from the health department to the schools. I won't go into detail. I'm sure you're aware of his testimony, but he basically says DOH is hanging schools out to dry. Does DOH have a communications problem when it comes to the schools?
So first, the Department of Health is here to support schools in making sure that they can have in-person education safely. And we have a team of epidemiologists, as we have had throughout the COVID-19 pandemic, to support schools. Of course, the school year has caused a lot of questions with a lot of schools operating in person, and we're doing our best to evolve our process to be more responsive. Just this week, we were able to speak with some of the intermediary units about directly taking their feedback and improving our process and improving our responsiveness for them. So as all parts of our COVID-19 response have done, we're going to continue to evolve and refine that and hopefully be more communicative with schools moving forward.
Next up, we have Dennis Owens with ABC 27.
Hi, Secretary. Thanks for doing this. I want to follow up on Mike's question because I was at that hearing last week as well. Was there a formula last year that you had for schools? That is, if Mary tests positive and she's got to quarantine for X amount of days, and if she came in contact with certain kids, whether or not they were sick, they had to quarantine. Was there a formula on that for last year that now we're leaving it up to the schools? Can you speak to that? Because I'm hearing you can issue some guidance, but there are the devil's in the details, right, on the specifics of how we're dealing with this kid and this circumstance and that circumstance. And is that varying by school district across the state?
So thank you, Dennis. This is helpful. So let's start with what has changed since last year, because I think that's also an important reminder for folks about how we are continuously emphasizing in-person education this year. Remember, compared to where we were in September of 2020, at that point, many schools were virtual or hybrid, and now we are trying to encourage schools to do in-person education safely. By way of case count, for September 22nd to September 28, 2020, there were a total of 745 COVID-19 cases in school-age kids, compared to 7,357 cases in the same age group during this same week in 2021. So of course, our teams are still trying to support schools and actually doing that exact analysis that you're speaking to. Who needs to be able to be quarantining to stay safe? Who should be monitoring for symptoms and the like? Ultimately, that guidance this year is adopted from the CDC, but our epidemiologists are there to support schools as they go through that analysis about who needs to be isolated, quarantined, and the like.
Next up, we have Maddie Hanna with the Philadelphia Inquirer.
Hi, I'm wondering, I'm not sure if this question is for Secretary Ortega or Secretary Beam, but in recent weeks, how many school districts, if any, have the departments reached out to regarding how they are granting mask exemptions, and if there are districts that where the department either department has taken issue with how these exemptions are being granted?
Sure, I'm happy to start. Or okay, actually no, I will allow you if you have that. No problem. Okay.
Thank you for the question, and I'm just going to repeat it for clarification. And this is the idea of whether or not the department is granting exceptions to the masking order that was issued by the Department of Health. There is no granting of exceptions to the masking order. There are some listed exceptions that were included in the order when it was released, and we provided guidance to the field with regards to how they go about ensuring that those are done. And many of the schools are following things that are traditionally processes and approaches that schools have, which is they make decisions on how to keep the campus or the school safe, and have issued information to the parents as well to guide them on how they're going to make that decision as well.
Our next question from a reporter is from Mick Stinelli from the Pittsburgh Post-Gazette.
Hi there. This question is for Secretary Beam. I know this is something that's been asked before, probably many times, but what can you say about the future possibilities of requiring vaccines for teachers and/or students in Pennsylvania schools?
Sure. So specific to the COVID-19 vaccine, of course, we're excited about the developments for even having students in the school ages able to access the vaccine, which was a part of the remarks today. But at this time, there is not a contemplation of requiring the vaccination within our educator population. And of course, we're really focusing on just having our students be able to access it, not mandated at this point.
Our next question comes from Jamie Martinez with Spotlight, Pennsylvania.
Hi, Secretary Beam. Thanks for taking questions. This question could be for you or for Secretary Ortega. Do you know why relatively few districts are participating in the school-based testing so far? Are you getting any feedback, or do you have a sense of when that rollout might pick up a bit, or if it's expected to pick up a bit? Thank you.
Sure. So, Jamie, thank you for that question, because we want schools to first know that there's no deadline here. You can actually enroll as a school at any point in this school year in this entirely federally funded initiative. So it is at no cost, and it not only provides the tests to schools, but also the staffing to help actually administer those tests. With that being said, I think any reluctance on the part of the schools may be because we need to continue educating them on the availability of it. And of course, we've tried ad nauseum to make sure schools are aware of it, but we welcome anyone else actually joining us and making sure that their children that are in school actually have access to this program too. So speaking with school leadership about it, making sure folks are aware of it and aware of the breadth of testing supplies and staff that are available to participating schools is going to continue to be our responsibility to educate and allow schools to get interested in it.
Now we turn to Brian Miskowski from the Scranton Times-Tribune.
Hello, Secretary Beam. This one is for you. I'm aware of at least one school district in our coverage area that has allowed for masking exemptions to be granted without the involvement of a medical professional, only a parent or guardian signature. I was wondering if the DOH is concerned about the potential abuse of such a measure, and are there any plans to potentially amend the masking mandate in schools to ensure exemptions are being handled appropriately?
So, as Secretary Ortega explained, there are enumerated exceptions within the masking order for reasons that folks may not actually be wearing a mask in school, but just having a parent's frustration with the order is not one of them. And so we're going to continue to work with schools to make sure they are in compliance with this order to, again, keep students and teachers safe and retain that in-person instruction this school year.
Next up, we have Tom Lehman with WGAL.
Secretary, I know that the administration had talked about revisiting the mask mandate at a certain point. Can you talk a little bit about where things stand on that? And also, going forward, a lot of our viewers have wondered what exactly will you guys be considering as far as either altering that, removing it, just in the future, what should people expect, and where is the administration standing right now?
Sure. So we are continuing to review, first and foremost, the CDC guidance, but ultimately also those school-age cases of COVID-19 in the Commonwealth and our levels of community transmission, which, as a reminder, 67 of 67 counties in the Commonwealth right now are at high or substantial transmission. And so that transmission not only accounts for case counts, but also test positivity, all which are factors we're considering as we continue to look at a point in time in which it is safe to lift the masking order.
Our next question comes from Jan Murphy with Penn Live.
Hi, Secretary Beam. I was wondering, when you mentioned on the testing, the 400 schools, are you talking about 400 school districts? Are they 400 public and private schools? Can you just elaborate a little bit more on the involvement in that testing program?
Yeah, so that's schools, not school districts, and also public and private schools are able to actually avail themselves of this initiative.
We now have Boris from the Scranton Times-Tribune.
Hi, Secretary. Given the lagging vaccination rates in school-age children, I'm wondering why the state is not contemplating mandatory vaccinations for students. We know about the efficacy of the vaccine, and it seems like a natural.
Sure. So as a reminder, folks down to 12 right now are still able to get vaccinated, and we are focusing tremendously on educating parents, educating students about the safety and the efficacy of the vaccine so that they seek it out rather than doing it through a requirement. And then those down to age 5, we're eager to even just get approved for access to the vaccine, which is where, again, we're focusing our efforts on accessing the vaccine rather than requiring it at this point.
Now we have Asia Tab with CBS 21.
Hi, this question would be for Secretary Ortega. Secretary Ortega, my question is, what would it, with the shortage of school bus drivers, what is the impact that that has right now and in the near future?
Yeah, and I think that I appreciate the question, and I just want to assure everyone that we've been doing a tremendous amount of effort and outreach and making sure that we identify the enormity of the problem. This is not a Pennsylvania exclusive concern, right? This is a national concern that's varied from state to state, and everyone's making sure that they have the right strategies to address this. We hear anecdotally from a number of school districts what the impacts there. Most recently, we've had conversations with even the School Bus Association as well to try to assess what the impact is. And so we're working to really understand, and we're beginning to roll out some strategies as was announced earlier in this press conference with the Pennsylvania Department of Transportation to make sure that we address these and continue to provide the transportation needed for our young learners to get to school.
Our next question comes from Marley Parrish with the Pennsylvania Capital Star.
This is a question for Secretary Beam.
Hello.
Going back to communication with school districts, what opportunities are available for administrators to talk with members of the Department of Health and the team of epidemiologists one-on-one outside of an email?
Yeah, so we have a team that is actually set up dedicated to schools. And what we've been working on is making sure that any routine reporting to this team is separate and apart from a school that's actually raising their hand and saying, I have a circumstance that I need that one-on-one conversation with you with. That is now going to be able to be elevated and really prioritized from our team to do the outreach. And so in addition to the webinars, and in addition to all the materials we've prepared for schools to help them and guide them through this process of understanding better what to do when a case is identified, we want to make sure that they're also able to directly outreach to the Department of Health when they have that more nuanced circumstance for us to work through.
Our next question comes from Mallory Falk with WHYY.
Hi, I believe this question might be for Secretary Ortega. Here in Philadelphia, the superintendent has said that he reached out to the governor's office about potentially deploying National Guard members to help with transportation, as Massachusetts has done. And I'm wondering if that's something that was seriously discussed. He said ultimately the governor's office was not in favor of that, but I'm wondering if you could talk a little bit more about whether that's been a consideration.
Sure, and I want to circle back to just emphasize, we're beginning to understand the magnitude of the problem, and we also want to make sure that when we provide a solution to addressing some of the shortages that many of our schools are experiencing, that is one that has an equity principle in mind, right? To make sure that we can not pick and choose as a state on who we're going to support and not, but to make sure that we can connect with the network of individuals who are trying to address this for all folks. So a number of conversations have happened with regards to the strategy, and we've certainly, I think I mentioned earlier, this is a national problem. We certainly are looking to some of the solutions that are being employed in other states to see if that will be effective in the Commonwealth as well.
Our next question comes from Amelia Winger with Public Source.
Hi, this is a question I think for Secretary Myers, but to address the bus driver shortage, how many drivers would you like to hire and not just recruit? And can you quantify this need, and how many drivers would each district need on average?
Well, from the standpoint of the shortage, there are shortages in various school districts that varies from throughout the Commonwealth. And so really from our standpoint, we want to get as many individuals as possible who are interested in becoming a school bus driver involved in the process. And the first part of that is obviously getting a CDL, and that's one of the reasons that we have the additional testing that we're offering. And as well, we want to educate individuals about the opportunities that exist for the ability to drive a school bus. And so that's the purpose of the letter. And attached to that letter will be information on how to enter information on a survey that will then go to the school districts, making them aware of the fact that you're interested in becoming a school bus driver. I want to assure everyone too, and this is extremely important, that we want to do everything we possibly can to expand the number of individuals who are with school bus endorsements to be able to get our children to school. That's the critical part of all of this. But we also want to make sure that we do it with safety in mind. And that is the reason on why the processes that we have in place today are so critical to ensuring that we have safe drivers working in the industry and getting our children to school safely, but most importantly as well, ensuring that they have the opportunity to have education at the schools themselves.
Our last question for today comes from Jim Meltwart with KYW News Radio.
Hi, I guess this would be for Secretary Beam. How much focus is on hospitalization and severe illness versus simple case numbers? And I know you're probably going to say you're following CDC guidance, but are you looking at severe illness and hospitalizations as the vaccine is proven to be significantly effective at preventing severe illness, especially as we get to a point where that vaccine will likely be available to most school-age children?
Yes, we are very closely monitoring our hospitalizations, particularly our pediatric hospitalizations, because that population cannot be vaccinated. And so what we know is that in addition to the normal patient load that many of our pediatric hospitals are currently handling, they also have those that have COVID-19. We also have flu and RSV coming back. And we know that those hospitals are being tested on their capacity. And so, of course, we're watching hospitalizations because mask wearing is another tool to make sure that our hospitals are not getting overrun and that children can get the access to health care no matter their reason for being hospitalized.
Thank you all for your participation in today's news conference. It was recorded and will be available on PA Cast later today.